Dr. Daniel Sova recommends a specific population be screened for lung cancer, including patients ages 50 to 80 who have a significant smoking history.
And by that, I mean they have a 20-pack year history of smoking. And what that means is that they've averaged smoking a pack a day for up to 20 years or the equivalent of that. So they could have smoked half a pack for 40 years to get to that mark. So those people would meet the requirement to be screened with a low dose CT.
Dr. Sova says the CT scan is a simple process.
We don't need to start an IV or anything invasive. So they just come and lay down on the table. They've got to do a simple breath hold for maybe 5 to 10 seconds. So it's actually a pretty quick exam.
Dr. Sova says they use a low-dose CT scan done on a yearly basis.
We also don't want to give the patient too much radiation over their lifetime. We found a Goldilocks zone for the amount of radiation we can give to these patients without over-radiating them while still getting the benefit of early cancer detection.
Early detection for cancer is the key to the best outcome.
If we catch cancer when it's stage 1 disease, meaning that it's confined to the nodule or cancer right in the lung where we see it on the CT, we have up to a 90% survival rate. Whereas if we wait until we're symptomatic, oftentimes the disease has spread distantly. At that point, your survival rate drops from 80 to 90% down to 5% or something around there.
A patient with a positive screen may have to undergo some additional testing, including a PET CT, where nodules are more closely examined.
Typically, cancers have a higher metabolic rate than non-cancerous nodules. And if that portion is positive, then we may have to sample the nodule with a biopsy, which is where we place a needle into the nodule and then send it to pathology to see if there are any cancerous cells under the microscope.
He says the risks of getting the screening done are minimal, and it is crucial for early detection of cancer.
Yeah, the radiation is really the big one. There's not really another risk per se. And, if you get an indeterminate screen or a positive screen, it causes patient anxiety because they're stuck waiting to find out if they have lung cancer. But in my opinion, the knowing is better than the not knowing. And the key is really early detection, as with any screening program.